Hello everyone, welcome back to Medical Coding Club. This is Chandrika. So today let's discuss a few important questions from medicine section for your 2025 CPC exam. Okay, so the first question we have: a dermatologist treats recurring psoriatic plaques using EXCIMER laser therapy, and total square centimeter of that plaque is 400 square centimeter. Okay, so as soon as you see dermatologist or as soon as you see skin related condition, don't always assume these skin conditions will falls under integumentary section. Okay, few procedure we don't use from IN section. Okay, instead we will have the separate procedure. Those separate procedure will be listed under medicine section. So in that example include this particular procedure also. So I'll show that. So you can see the options. You can pause the screen and you can just take your time and navigate all the options. You can also able to get the correct answer. So here, so you can see here special dermatological procedures are there, and they are saying see evaluation and management coding guidelines for further instruction on reporting the appropriate management of dermatologic illness. And for intralesional injection, C1100 to 11901. 11900 and 11901. So we have a separate procedure in the integumentary section. There you can go ahead and check this particular procedure. But when they're talking about dermatologic EXCIMER method, so we will get the code from here only in this section. So see 96920 EXCIMER laser treatment for psoriasis, total area less than 250 square centimeter, and 96921 250 square centimeter to 500 square centimeter. So they have utilized EXCIMER laser treatment. Okay, the meaning of this procedure is that dermatologist, he will treat the skin conditions like psoriasis utilizing UV light. Okay, so they will target the plaques and they'll treat with the UV lights. That is what EXCIMER laser treatment or therapy meaning. And since we have 400 square centimeter, the correct answer would be 96921. Okay, 96921. You can see answer is B. 96921 is correct. So next question: a postpartum female undergoes anorectal biofeedback with the anal MANOMETRY. Okay, MANOMETRY. So here, what CPT code is reported, you can check here. They are talking about biofeedback procedure. So biofeedback, like the procedure is, it's kind of technique where they'll help the patient to gain control over muscle functions. So here they are treating anorectal in the sense anal MANOMETRY they are utilizing to measure the strength and coordination of muscles in anus and rectum. Okay, that is how they are performing anal MANOMETRY. Okay, so meaning of biofeedback is like as I said, they'll use this biofeedback method or technique on to treat the bowel diseases like constipation and incontinence. Okay, all these things will be included. So let's check the answer. So biofeedback 90901, biofeedback training by any modality. 90912, biofeedback training with MANOMETRY and anorectal. Okay, so 90912 you can code. So since in our question they did not mention more than any extra 15 minutes, the total time here they have given is 15 minutes. Okay, so for 15 minutes you can check. Initial 15 minutes code would be 90912, and if you get additional 15 minutes, then you can utilize an add-on code also with your primary code. So since we have only initial 15 minutes, the correct answer for this question is option A, 90912. Okay. So next question. A 70-year-old with a chronic bilateral leg pain and suspected DVT has a duplex scan. What CPT and ICD codes are reported? So you can see here it is both ICD they have asked and bilateral leg pain and suspected DVT has a duplex scan. So procedure they have utilized here is duplex scan. So as you all know, duplex scan means like with combining ultrasound and Doppler, they'll perform this procedure to view uh, like the vein very clearly to see the blood clot. Okay, if blood clot is there in any vein, okay, they will use this duplex scan method and they'll find out, okay, where exactly on which position there is a blood clot. Okay, so DVT is deep vein thrombosis. So here bilateral leg pain is there. So easy, since they have given bilateral leg pain, you don't code separate ICD code. If you have a bilateral ICD code, you have to code single ICD. Okay, so first we'll find the CPT. So extremity venous studies including digits 93970, duplex scan of extremity vein including responses to compression and other maneuver, complete bilateral study. So it includes bilateral study. So 93970 is correct. And 9397 is unilateral or limited study. That means any one hand or they are doing one leg or one hand. That time we can go with 9391. But if they perform bilateral, we should go with 93970. Okay. So now coming back to 93970, option B has 93970 and option D also has 93970. But ICDs we can see option B include I80.03 and option D include I80.01 and I80.02. So this is wrong. Okay, why? Because I80.01 is for right leg and I80.02 is for left leg. Okay, but the pain is same. Chronic pain on 180, I80.01 is for right leg and I80.02 is for left leg. So they have coded separately. But you just have to check, do we have any bilateral ICD code? Okay, according to ICD coding guideline also, if bilateral code is exist in the ICD manual, you are not supposed to use a bilateral. I mean, you cannot separate the ICD with laterality. Okay, so you can check the ICD in the ICD book. You can, or else I'll just show, right? So you can see I80.01. So you can see right lower extremity. 02 is left lower extremity. Okay, condition is same. Okay, only laterality differs here. But in our question, they purely documented it's a bilateral. So just check, do we have a bilateral code for the same condition? Yes, we have bilateral code for the same medical condition. So we don't have to code them separately. We will just go with a single ICD code. Okay, so the correct answer for the third question is option B, 93970 with I80.03. Okay, and next, patient undergoes a Venom allergy test. So there are 8 scratch, 8 puncture, and 6 intradermal. Okay, and what CPT code is reported? So let's check. So see, in medicine section, allergy test and allergen immunotherapy test. Both are very important. Okay, allergen immunotherapy, we will check whether the doctor or the provider is only giving injection as a procedure or he is performing both provision and injection. So likewise the codes will change. Okay, only injection means patient will buy the medication or he will bring the medication from outside. Doctor will take that medication and he will just inject. Okay, that are separate code set we have. And one more code set is like provision and injection. Provision meaning is antigen, the provider only, he will only prepare antigen and then he will inject to the patient. Okay, that is again a separate code category. So here we have to check a single injection they have given or dual injection they have given. Okay, that belongs to allergen immunotherapy. But here the question is about allergy test, not immunotherapy. So let's see the answer. So you can see allergy testing. Under allergy testing, you have to look for that, scratch, puncture, and prick. 95017 gives allergy testing any combination of percutaneous and intracutaneous, intradermal, sequential, and intracremental with venomous immediate type reaction, including test and report. Specify the number of test. Okay, so this is important. Specify the number of test. So it includes scratch, puncture, and prick also. But we don't know how many scratch are there, how many punctures are there. So in the question, if they document, you can add them together and you can show it with the units. Okay, 95017 is there. So here 8 scratch, 8 puncture, 6 intradermal. So 8 plus 8. Okay, so you will be around getting 16. And 16 plus 6, you will get 22 units. So we have two options with 22 units. Option B 95081 and option C 95017. So 95017 includes scratch, puncture, prick, and intradermal also. And 95081, you can see what it is. So 950. Okay, I don't think, maybe that code is out of numerical order. You can just check it. Okay, the correct answer is 95017. Since it includes all, you can just give units. You can specify the number of tests. So total 22 tests. 95017 with 22 you can give. Okay, so any discrepancy, let me know in the comment. Option C is correct. So next question. Medicare patient that is on dialysis for ESRD, that is end stage renal disease, is seen by nurse for hepatitis B vaccination. The patient given a dialysis patient dosage is a part of 3-dose schedule. So here you can just see they have specified the payer name as a Medicare. Okay, so when you are getting a Medicare as an insurance, please be aware about the payer specific coding guidelines. Okay, it can be hepatitis or it can be pneumococcal vaccine or it can be influenza vaccine. We don't use our CPT codes. Okay, this CPT we don't code from 9 series. Instead, we should code it from HCPCS section. Okay, that is G series code we will utilize for hepatitis B vaccine and pneumococcal and influenza. Okay, G series code we will use. If they mention influenza, we use G0008. Okay, normal 90471 or 90460, that code we don't take it. Okay, since payer is Medicare. So the correct answer for this particular question is option B. Okay, since G0010, this HCPCS code is for hepatitis B vaccine. Okay, admin code. And this one is product code. Product is nothing but vaccine code. Hepatitis B vaccine code is 90740. So whenever we code for vaccine or injection, please be aware we will code one admin code, that is administration code, and next one is product code. If they are using drug, the drug code will be coded, or if they are using any vaccine, that vaccine code should be coded. Okay, two codes we will code it. And please check ICD also. So for this question, correct answer is option B. And then patient with circumflex stent and dyspnea undergoes ventriculography after failed angiogram. What CPT code is reported? So here the question is about ventriculography. So what is that means? What procedure is that? So this procedure is like, it is again kind of imaging test. They'll use the contrast dye, okay, to look the heart ventricles, that whatever the pumping chamber will be there. So that to visualize that, they will use this ventriculography procedure. Okay, so we will check for the particular answer. For left ventriculography, so undergoes ventriculography after failed angiogram. So for this answer is 93452. 93452. So the question is little incomplete here. Okay, since it's a keyword, the question will look like this. So just the procedure, whatever the procedure we have on catheterization, it is important. So catheterization is a very big topic. Okay, so we need to take one session for this and need to cover coding guideline, and then if I take practice question, you can easily understand. So that now I'm just showing you the question. Please navigate and go through all the codes. So in future, I will create video on that particular topic itself. And same way, one more question on that. This is again regarding to ventriculography only. Okay, but here it is from utilizing catheter. Okay, catheter code. So the correct question, or sorry, the correct answer for this, see, performed using power injection of contrast agent. So contrast agent code is 93458. Okay, 93458. I'll show that. 456. This one. 93458 will come. So let me explain this question in any other videos. Okay. So next one. A 49-year-old patient arrives with hearing loss in his left ear. Impedance testing via tympanometry is performed. So what they are saying here, tympanometry is a procedure. So they are checking middle ear function. Okay. So like when they mention this impedance, it is like mainly they'll be focusing on the movements of eardrum. Okay, to diagnose ear infection or fluid behind eardrum. Okay, behind eardrum, if any inflammation or fluid buildup is there, then they'll diagnose this. Okay, using this kind of treatment techniques. So you can just go to tympanometry. Under tympanometry, look for impedance testing. Audiologic function test. Under audiologic function, tympanometry with tympanometry impedance testing. 92567. 92567. Okay, option B is correct. So next question. Wait, one more audio related question is there. So the mother expressed concern about hearing of 4-year-old. Provider performed hearing screening with the child wearing headphones to listen to the series of tones. Child is instructed to raise either hand when tone is heard. So this is again the procedure called pure tone audiometry. Okay, pure tone audiometry or screening audiometry. I think here they did not perform pure tone, only they have mentioned tone, screening tone. So let's see the answer. Okay, so 92551 screening test, pure tone air only. 92552 pure tone audiometry threshold air only. So our question is about screening test. Okay, so since it's screening test, we will select 92551 as our answer. 92551 as the answer. Okay, so other question includes, so you can see here this question is about ophthalmologist. So procedure I'll explain. Ophthalmoscopy. So in the ophthalmoscopy, we follow ENM coding guidelines only. Okay, for new and established patient. The procedure. Okay. This is the question 920. Nine two zero 81 and 82. So this is again we have to check how many isopter they are using. Based on isopter, we will code it. Okay, so I think how many isopters they have coded? 4 isopters they have utilized, and they're also saying Goldman perimeter. So the meaning of Goldman perimetry, like it's a visual field test. Okay, so they will utilize like this test is all about mapping the person visual field. Okay, so if patient is having migraine or a glaucoma condition, or in maybe stroke patients, for these kind of patients, they'll usually suffer from more related to eye. Since they have migraine, they'll have the pain in their eye. So we have to check how many isopter they are using. Accordingly, we will code it. So please check, since I don't note down the ICDs. So check the answer for this. I'll try to give answer here. 92083 is what? Okay, at least 3 isopter. Okay. So 92083 is correct. Since we have 4 isopter, you can select 3, at least 3 isopter. 92083 is correct. With 92083, check for this ICD G43019. I think it is related to migraine. So option D is correct. Okay, so please look for ICD also. So next one. So patient present with a recurrent spontaneous episodes of dizziness of unclear etiology and caloric vestibular testing is performed. Irrigation of both ear with warm and cold water while evaluating the patient's eye movement. There is a total of 3 irrigation. What CPT coding is reported? So here the question is about 3 irrigation. There is a total of 3 irrigation. So we have one particular coding guideline for this. Okay, let's check that coding guideline. So vestibular function test. So vestibular function test means like they'll do this, that balance test that involves both warm and cold water. Okay, they'll use this both methods, into that ear and that, what to say, inner ear and brain, like how this is working. So that usually both you can see here. Sometimes they use 1 year hot water, 1 year cold water. Sometimes they use both methods. So the clarification, or the provided documentation should be very clear here. So vestibular with just see monothermal and bithermal. Bithermal means both warm and cold. So 92537 include both one warm and one cool irrigation. And see here, there is a note for 3 irrigation, use modifier 52. 92537 include total of 4 irrigations. Okay, but in our question, they are listed as there are 3 irrigation. Since they have said it's a 3 irrigation performed, we need to use 52 modifier to tell them that service has been reduced. Okay, we are not doing 4 irrigation, we are just doing 3 irrigation. So answer is 92537 with 52 modifier. Okay, so this coding guideline you can check here. This is the guideline we have. If they use 3 irrigation, use modifier 52. Okay, so answer A is correct. So I think that's all. So for more questions and from basic to all the concept discussion with practical question explanation with answer, please to join live classes. Okay, in the classes you will have the continuity, and you will be able to dedicate yourself for 2 hours, and you can learn all the concept from the basic. Like even if you are coming for revision, many students will not be aware about many concepts. Okay, so it will be an additional workup for you. It will definitely help you in the exam and then for your future career advancement also. Okay, so consider joining the classes, and if you have exam within this month, then I can provide recorded classes, okay, with important material if you purchase. Or if you want to join live classes, then live classes will next batch will start in May only. Already current batch is running, so next new batch will start in May or April 28, 29, like that. Okay, so that's all for today. Day after tomorrow, maybe by Saturday or Sunday, I'll try to cover ENM course. Okay, thank you all. Thank you for watching. And many of you are messaging me through WhatsApp saying that these videos are very helpful. So rather than texting me on WhatsApp, please do comment in the videos. Okay, that will be more helpful for me to reach even more, wider audience who are medical coding professionals, and who are all preparing for exam. Thank you all. Please do subscribe and support to my channel.